My name is George Smith, and I'm intern at the UT Health and Medical and Research Center, and I'm covering the effects of different lifting techniques on the lumbar spine. The lumbar spine is the lower back that begins directly underneath the last thoracic vertebrae, also known as T12, and is composed of 5 different vertebrae from L1 to L5. A single lumbar segment contains 2 consecutive vertebrae, an intervertebral disc, 2 fossa joints, and 2 spinal nerves. The movements in the lumbar spine are flexion, extension, rotation, and lateral flexion. These movements occur together with gliding and rotating movements in the coronal, sagittal, and horizontal planes and results in different forces known as shear force, tensile force, compressive force, bending, and torsion movement. In order for movements to occur, the inferior portion of the superior facet articulates with the superior portion of the inferior facet. Out of all the segments of the spine, the lower spine has the largest vertebrae. This is due to the main function of the lumbar spine in conjunction with the muscles, which is to bear the weight of the body and absorb the stress of lifting and carrying objects. The lumbar spine also has other functions such as protecting the spinal cord and controlling leg movements. The upper vertebrae protects the spinal cord with their vertebral arches by forming a protective canal. Between the vertebrae is a vertebral foramen, which allows the nerves to exit through and leaves the area protected, with the lumbar spinal nerves controlling the movements and sensation of the legs. Due to the importance and role the lumbar spine plays, when performing any lifting, it is crucial to keep it healthy and prevent risk of injury. Though there have been controversy over which lifting technique is considered optimal and safer to prevent lower back pain, as the squat technique has been generally accepted as the preferred method, studies and research may suggest otherwise. The squat technique is shown by having your feet shoulder width apart, toes slightly out, core braced, and chest up. When performing, hips are to be pushed back and bending at the knees, occurring until the thighs are parallel to the ground, then pushing off to the foot and returning to the starting position, keeping the lumbar spine in a neutral position throughout the movement. However, the stoop technique involves keeping the knees straight and bending of the lumbar spine, putting the lumbar spine in a flex position. The squat technique was previously known as a corrective technique because in 1956, due to references from James Cyriax, an assistant medical officer in the physiotherapy department at St. Thomas's Hospital, a letter was published that suggested that patients who were prone to lower back pain were to avoid heavy lifting involving trunk flexion. Advising of bending at the knee instead of forward, Dr. Cyriax stated that full flexion encourages lower back pain. Dr. Cyriax's article would later be considered as an article of faith that convinced others that lifting should be carried from a full squat posture. To this day, the squat technique is the most encouraged lifting technique to maintain lower back stability and prevent injury. However, an article titled Stoop or Squat, a review of biomechanical studies on lifting technique, was published with the objective to assess the biomechanical evidence in supporting the squat lifting technique to prevent lower back pain. Because of intervention studies not showing any health benefits between the different techniques, the rationale behind the techniques was put into question. Biomechanical studies comparing the two techniques were to be reviewed. By measuring interdiscal pressure and spinal shrinkage, results showed that there was no significant difference in spinal compression. Net moments and compression forces were higher in squatting, and shear force and bending moments on the spine were lower in squat lifting, but were below injury thresholds in both techniques. And lastly, net forces and compression forces reached magnitudes in both techniques that could cause injury. The article concluded that the biomechanical literature did not support advocating squat technique over stoop technique as a means to prevent lower back pain. In June 2018, a study was performed with the objective to investigate the role of the lumbar spine shape in lifting kinematics. 30 adults within the age of 18 to 65 years old selected weighted boxes ranging from 6 to 15 kilograms and performed freestyle, stoop, and squat lifts while being recorded by Vicon motion capture. Internal spine shape was being measured using statistical shape modeling from standing mid-sagittal MRIs. 2 statistical shape modeling models were used, with one measuring overall lumbar curvature and the other measuring evenness of the curvature distribution. Results showed that with the statistical shape modeling models, individuals with greater spinal curviness preferred to lift with a stoop technique, and that overall spinal curvature affected lifting styles. Lastly, an article titled In Vivo Loads on a Vertebral Body Replacement During Different Lifting Techniques was published with the objective to measure whether squat lifting led to lower spinal loads than stoop lifting. Instrumented vertebral body replacements were used to measure the in vivo loads of the lumbar spine. 3 patients were measured at L1 and 1 in L3. During 17 measuring sessions, stoop and squat lifting were performed a total of 104 times, with trunk inclination and knee bending being estimated from recorded images. There was only a 4% difference in the resultant force observed between the two techniques, even though knee bending angles and trunk inclination were considerably different during points at maximal result force. The study did not provide any evidence that spinal loads different between squat and stoop lifting. Although the stoop technique was ruled off as the unsafe method and the cause of future lower back problems, studies have shown that there is no difference in spinal compressions or spinal loadings and found no evidence supporting that the stoop technique led to a higher risk of lumbar pain than the squat technique. This concludes that the stoop lifting can be considered just as safe as squat lifting and shouldn't be used as a cause for lower back injuries or pain.